Emily, you and I are kindred spirits in that we like tests and things that yield um, tangible results that we can look at. You and I have shared a lot of tests together over the years between Florida and Jersey, and the Digitherm, which you use to screen, which was a part of my screening process as well. So, what was it that sparked your interest and devotion to the link between musculoskeletal pain and clinical signs of behavior disease?
Yeah, so I would say for a long time, I had the luxury of working in spaces where I could watch an animal walk around a consult room, at their leisure, doing their natural movements. Um, and I was like, gosh, something seems off. And for many years, it was really a struggle to get clients to buy into working up their dog for discomfort or pain because they just couldn't wrap their minds around it. So it was really a hard thing to really explore until I read one day about thermal imaging. And I thought if there's any way that we can evaluate dogs where the clients can see something to help them go, oh, I see it with my own eyes. And also for patients where maybe they're too aggressive to do an exam on, or they're just stoic, they shut down, but I can tell by the way they're walking, they're uncomfortable. Or for dogs who are just so anxious, it's hard to get a good read when doing a physical. So when I said I'm going to look into thermal imaging, that was really like compliance rate skyrocketed to like 90%. Now they're going and getting x-rays or following up with an MRI, or they're going to the rehab or the sports medicine person. They're following up and they're open to doing pain med trials. And just the response we're seeing is just enormous, to be quite frank. It's like such a big part of our practice is to help clients recognize that pain is an issue, and I help tease it apart for them. And then they're much more inclined to follow through. And it's been a source of joy for me to be able to help these animals in that way. It's been eye-opening for the clients. And it's a big push we have to make with pets who present with behavior problems. We must rule out soreness, discomfort, etc. We all have this mindset when we hear pain. Um, and a lot of times when we as veterinarians or dog owners hear the word your dog's in pain, but they run, they play, we have this envision of pain being to the point of dysfunction. Like when your leg is broken, yes, you can't use it. That's dysfunction. But man, there's a whole gamut of feeling unwell well before that point. And also just knowing a little bit about animals' cognitive abilities. If they're super motivated to do something, they're going to do it. They want to play ball, they get a treat, they're going to do it. But now they're resting and they're sore, and you go to pet them and they're like, not now, I'm sore. And the other thing is, like, I no longer will ask pets to sit down on cue to assess if I see subtle gait
Oh,
abnormalities,
yeah.
because when their mind is in performance mode or gotta do mode, everything suddenly looks perfect.